In low and middle-income countries, the knock-on effects of COVID-19 are creating a perfect storm. Fragile health systems are under desperate strain. In African countries, there's an average of one health worker for every 714 people, compared to 81 people in the wealthiest countries. The world's deadliest infectious diseases, HIV, tuberculosis, and malaria, already kill 2.3 million people every year, mostly in low and middle-income countries. These infectious diseases are resurging, with deaths as much as doubling this year due to the knock-on effects of COVID-19. And in 2020 alone, disrupted economic activity and job losses could push up to 115 million additional people into extreme poverty. These indirect knock-on effects of COVID-19 in low and middle-income countries could far outweigh the direct impact of the pandemic. Over the last 20 years, the Global Fund Partnership has dramatically reduced deaths from the world's deadliest infectious diseases, HIV, tuberculosis, and malaria. As the largest provider of grants to strengthen systems for health, we invest more than $1 billion a year in health systems, including community health systems, in more than 120 countries. With communities in the lead, we work to fight stigma and discrimination, protect human rights, and ensure that the most vulnerable people around the world can access the healthcare they need. Our approach to fighting infectious diseases is working. Together, we've saved 38 million lives. Since the pandemic began, we've moved rapidly. We've been flexible. We've leveraged our expertise and extensive global networks and made significant funding available to fight COVID-19. The Global Fund has also helped create the Access to COVID-19 Tools Accelerator, a groundbreaking collaboration of global partners to turbocharge the development, production, and equitable delivery of new tests, treatments, and vaccines. This partnership is working. New tools and solutions are being developed and distributed, but more funding is needed to keep delivering results. The Global Fund is also running out of resources, and more funds are urgently needed. To play our part in the global fight against COVID-19, we need at least $5 billion to cover the most urgent needs, which contributes to the funding needed for the ACT Accelerator. We must ensure equitable access to tests, treatments, and vaccines, while protecting decades of progress in improving health outcomes for the most vulnerable people in the world. We cannot afford not to step up investment to fight COVID-19. No one is safe until everyone is safe. Support the Global Fund. Unite to fight COVID-19.